Hello, my name is Gabriel Ortiz. I'm a physician assistant. I'm practicing at Breathe America in El Paso, Texas. I have been practicing in allergy and asthma type practice since 1991 and have been involved with numerous clinical trials as well as publications for several therapeutics in allergy and asthma products. My current discussion is about presentations that I presented at the CARPS conference in Orlando in July of this year. My two topics are spirometry and asthma, which go hand in hand. My next topic in asthma has three very important topics or takeaway messages. It's difficult to limit to three. First and foremost, again, I would strongly recommend the use of spirometry for the diagnosis of asthma. It's how we diagnose patients, specifically with asthma, and it allows us to be able to classify their severity, to be able to determine the correct therapeutic initiation of medication. Next, it's important to individualize therapy. Not everyone is the same. I predominantly like to treat pediatric population, and it's important to understand that pediatrics are not small adults. And therefore, I think individualization of therapy and patient preference of different therapeutic devices are important and difficult to use unless specifically educated. My next point, again, goes to education. Education goes a long way. For our patients, specifically in asthma, there is a lot of education that needs to be done for not only the medical condition, the disease, the treatment, and in therapeutic utilization of the medications. It's very important. Another takeaway message is to know when specifically to refer for those difficult to treat patients, especially in primary care, and not only to know when to refer, but also to make sure that you refer for any patients that are difficult to treat so that they get the adequate treatment and get good control of your patients with asthma.